Hello folks, this is Dr. Nurshing. Today we are here to discuss about microbiology. This channel is for MBBS students, DMLT and BMLT students and nursing students and all other peoples who are interested to study microbiology. Actually, you can't skip this subject just because it is a difficult and volatile subject. I know it is a difficult and volatile subject, but you can't skip it because if you can't understand microbiology, you can't go further understanding medicine, surgery, gynae, pediatrics and others. So you have to study microbiology and you can't skip it. So we have decided to make it clear and concise and make it eatable for you people. Okay, so in microbiology subject we have to study about hypersensitivity, immunology, which are very difficult topics, and bacteria, virus, fungi and parasites. Okay, so today we will just talk about how to study this kind of thing. Okay, you have to make note, you can't skip noting, otherwise in just before the exam you people are just like now what to study, how to study. This is a very vast, you have to do this if you are not start to make the note. How to make the note? Okay, I will discuss in bacteria. Okay, how to make a note in bacteria? In bacteria, virus, parasite and fungi, in every case nowadays NMC, you can say NMC or any other university, they will give you a clinical scenario. Okay, clinical scenario with clinical features. They will give you clinical features, and understanding those clinical features, you have to first diagnose is the bacteria, virus or any other microorganism. Once you diagnose the microorganism, you can proceed further. Like one clinical feature is the patient came with nausea, vomiting and pain abdomen, and his or her history is previous day he or she ate Chinese food. Whenever you see the Chinese food thing, you have to understand that this is a bacillus thing. Okay, and like that if you see any sore throat thing, like the patient have a fever, sore throat and any other kind of cough. Okay, now if there is sore throat, it means this is a streptococcus. So you have to memorize the key clinical features for each bacteria. Okay, now you have memorized the key clinical feature of each bacteria. Now you have to understand the pathogenesis. You have to write it down for every bacteria. Whenever you start any bacteria, like you will start with Staphylococcus aureus, you have to first write down the clinical features, then you have to write down the pathogenesis, how this bacteria cause the disease. Okay, now you have to understand, you have to write down the lab diagnosis, how to diagnose the patient, how to collect the sample, what sample you have to collect, you have to write it down. Okay, what sample you have to collect. Now in case of Mycobacterium tuberculosis, you have to collect sputum sample, or if any other kind of tuberculosis, you have to collect ascitic fluid, or you have to collect any you have to do any FNSE. Okay, like if there is any lump in the neck, for it's caused by Mycobacterium tuberculosis, then you have to collect the fluid from the lump. Okay, now this is the part of understanding, recognizing the which bacteria it is. Now you have to go with the pathogenesis, by which means this bacteria caused disease. Now you have to come to the lab diagnosis. In lab diagnosis, you have to start with the sample collection. You have collected the sample, now you have to do the gram staining or other kind of staining. You have to write down it also. Which staining is preferable for which bacteria. In case of Staphylococcus aureus, there is gram staining. In case of Mycobacterium tuberculosis, there is Zydenus staining, right? And there are Albert staining. There are a lot of staining staining procedure is there. And if this bacteria is motile means it has some leg, and the name of the leg of the bacteria is flagella. Now we have to recognize the flagella also. There is different kind of staining to recognize the flagella. If the bacteria is capsulated or not, if there is a capsule coat is there or not, you have to know there is capsule or not. Now you have to do the different kind of staining. So you have to know which staining is used for which purpose. Okay, now we have done the lab diagnosis part. In case of virus, which test you have to do: RT-PCR test, ELISA test, RIA test, okay, immunofluorescence assay. This kind of test you have to understand. And these are the way. In case of fungus also, KVH mount you have to do. I know you people think that there is a lot of name you are telling, ma'am, but no, this is not kind of lot of thing I am telling you. I will make it very clear and very easy for you people, day by day. Not in a single day. I can't make you a microbiologist in a single day. I can't make you a topper in a single day. You have to stick to me. Okay, you have to stick to me to make it clear, make it easy, make it non-volatile. We will discuss every now and then. You can ask me question every now and then. I will make the videos for you people every now and then. Okay, whatever you want to discuss, whatever you want to read, you can just give me a query. I will solve your query. Okay, but also I will go in a way that you people can understand that how to study the microbiology. And this is the now it is very starting for second year student, for MBBS students, and it is very in few days DMLT and BMLT students are also going to start their new chapter. New session will be start for nursing students also. Then you all can correlate with the sessions is going on, and every aspect of microbiology we will discuss. Thank you, and please subscribe the channel, and everyone please welcome everyone, invite your friends also to make the microbiology clear. Thank you.